Hello again, everyone. Mark Hackle, Macomb County Executive. John Paul Rea, one of our deputy executives. Once again, giving the update on what's going on with the COVID crisis here, specifically to Macomb County. And boy, I tell you, those numbers are getting close as far as the death toll. We're looking at almost 300 people. What do we got for today's numbers?
Mark, when we're looking at our updated community dashboard, we've got 3,600 cases confirmed in Macomb County and 293 deaths. Statewide cases have now risen over 27,000, and there's over 1,700 deaths statewide.
Yeah, it's kind of sad when I say that nearly 300. You know, you can pretty much anticipate, and that's the sad reality of what we're anticipating. Probably by tomorrow, we're going to see the additional 7 people are going to probably die here in Macomb County as a result of this COVID crisis. And it's starting to level off. We're starting to see the numbers kind of drop, but still, it's an incredible situation, you know, that we're seeing around the county as well as around the entire region and country.
Mark, a lot of people talk about flattening the curve. A lot of people talk about that plateau when we're going to be on the downslope. Even though we're going to be seeing a little bit of that with regards to it spreading out too, each day the numbers are going to continue to rise, hopefully at a lower rate with regards to all the personal responsibility, social distancing, stay-at-home orders that are in place. But these are the realities that are going to be in place for a number of weeks looking forward now.
And we know we have the numbers as far as the people that are tested positive by community breakdown, by zip code breakdown, and even that heat map that we have here in Macomb County. But we're also adding the feature of, you know, letting people understand the actual number of deaths by community to the website. We're going to have that up shortly. But boy, I tell you what, they're really, when it comes to the death toll, that's the definitive number. We're getting that from the health department. We know exactly how many people are died as a result of this and the communities that they're from. But when it comes to the people testing positive, that's kind of one of those targets that you really can't get your arms wrapped around. I mean, the numbers, I think, are far less than what we're actually recognizing that may be out there. People may have had it, never got tested. Some people just aren't going to get tested. So that's kind of it's one of those numbers that I think is underreported, if you will.
So, Mark, that's the biggest thing with regards to testing is whether you hear it from the governor, whether you hear it from Dr. Fauci or from the president with regards to upping that capacity. Obviously, we have our healthcare systems here that are doing a fantastic job getting people, you know, onto their campuses, tested, and really understanding if they're symptomatic, not symptomatic, how quickly can they get those tests. The regional test facilities that are up and running, also some other opportunities with, you know, an outpost even here in Centerline that has stood up some testing options. That's really where we're looking to get a lot of those critical resources right now to understand what the spread of this virus looks like and get a more true number, as you just illustrated.
And interesting, as you just mentioned, you're talking about the testing here early on. Boy, you saw some lines. I mean, whether it was Harrington for McLaren, even 19 Mile Road over there for the Henry Ford facility, but they're starting to slow down. You're not starting to see as many people in line waiting for those tests, but people can go ahead and get tested there. So that hasn't been the crisis or the problem here in Macomb County. We realized even with our hospitals looking for additional bed space outside of their facilities, they're managing it well. And I think that's important to recognize that if people do want to get tested, there are sites available for them to get tested. Obviously, the big concern is making sure that you maybe show some signs or symptoms before you drive on over there. And you don't need a prescription to do that. They don't need a script from the doctor. They'll take care of you if you get there. All 3 hospitals I mentioned, Ascension, Henry Ford, as well as McLaren here in Mount Clemens, and that additional site that's in Centerline right now that's providing an opportunity for people to get tested if they're concerned or worried about it. But the results don't come back immediately. I mean, that's the thing people got to realize. They get tested, they get sent home, say, hey, self-isolate, and probably, I think the turnaround now is about a 3-4 day turnaround because of the number of, I guess, tests that are being requested to turn around and figure out whether or not somebody does have it.
And Mark, there's no definitive benchmark there. It's going to change whether it's capacity of tests, you know, depending on where you go, your wait time, the lab that it might be sent to, how it's getting confirmed, when it gets logged, if and when an individual from a healthcare facility reaches out to you or the health department. All that information is continually being worked on with all those consortium partners that are working on that day in, day out. But again, upping the testing is going to be critical for us to understand the spread of the virus.
And our first responders here have an ability through that site over at Wayne State University. If they need to get tested right away, we've talked about it with our emergency management teams, the folks that are our contacts throughout the various communities in Macomb County, that if there's a first responder that needs to be tested, there's a opportunity at Wayne State where they're allowing that to happen. So there's a separate area area where they can go in and get tested if they feel like they have some kind of a concern, so they're not waiting in any lines. But I think our healthcare providers are doing that here as well. I think some of them had made that exception for those first responders and are testing them right away because of obviously the importance of their job and what they're doing.
McLaren's been one of the prime ones that has made, you know, special provisions for those folks, those first responders and frontline workers.
And the other thing, some people get confused about this, I guess this 20-minute test that's out there right now, and I think the only place that was able to secure some of those kits or those test kits was the city of Detroit. I think they got about 5,000 test kits that they got from one company, and if I'm not mistaken, it was called Abbott Labs. I
believe that's the one, Mark. Yes,
so
correct.
I think it's kind of like they're starting this process of seeing if they can't get them to communities. In fact, some point in time, I got to believe they're going to be on our store shelves where people can actually do this test and make a determination as whether they got it within a 20-minute period. But that's a very limited amount right now for one particular community. That's the city of Detroit. So the hospitals don't have them, the state of Michigan doesn't have them, we don't have those. And again, you know, 5,000, it may sound like a lot, but that's a very, I think, a very small supply. I think it's more just to kind of test and see how these things are working out. But again, you know, some people I think that those are readily available. They're just not, and it's going to be some time before they do become available.
Mark, it's really interesting too, the whole notion of the surge capacity of the hospital systems. Clearly there's a number of alternative sites that have been stood up with the TCF Center, also with the Suburban Showcase Center, but it's one of those things that here locally in Macomb County we're still seeing the capabilities of our healthcare systems and our general hospitals to be able to serve the public right now. So whether you have a test, whether you're symptomatic, whether you have other health concerns, right now those care options are available for you here in Macomb County, and it's something where I think collectively we got a sigh of relief as we stand here today.
Yeah, and just the other day, there's a requirement by any community, whether it's the state, federal government, we had to, I guess, get renewed that emergency declaration we have here for state of emergency for the county. We did that, presented it to the Board of Commissioners. May 17th was when it was going to be up. They supported that unanimously just yesterday, and so with that, obviously, we're going to continue on that state of emergency until I think it's May 22nd now for the county. And we have a feeling it probably is going to be even sustained further than that, but if there's a need to renew the actual state of emergency, we're going to do that. Gives us a chance, once again, internally to reallocate resources and personnel as needed. So it's without question something that's needed. The state has state of emergency, federal government has state of emergency. So I think that's why the Board of Commissioners recognize this is a very serious issue here in Macomb County.
Yep. Streamlining response and resources, Mark. That declaration gives us the ability not only to continually use our Emergency Operations Center, but also make sure that we're coordinating with all our partners, state, federal, and local level.
Yeah, and we got great relationships going there. Yeah, the big question, we keep going back and forth on this, you know, the issue of health and safety and the economy. And it's starting to see some tensions, and you're starting to see people getting pretty aggressive about, you know, positioning themselves on this issue. Many people, maybe some of you that are sitting at home listening to this right now, are saying, you know, how do we balance this? How do we deal with it? Understand there's still, without question, a crisis. There's still a concern. And just reopening up the economy, as most experts will tell us, the scientists, the health professionals will say, you're going to put yourself in a situation where all that contact, once again, starting to engage or connect, is going to bring back another apex or another peaking, and you don't want that to happen. So very cautionary situation, and difficult for the governor to make some of these decisions, a stay-home order, but she is doing it based upon, you know, the data, you know, whether it's scientific data, the healthcare experts, to try to make sure we're doing the right thing, and you know, with that comes some criticism, and understandably, but the frustration level is starting to climb a little bit right now with people.
Mark, the data is the key here. You know, you want to first see that reduction in tests, you want reduction in cases, you want to see the increased testing capabilities. You also want to ensure that the healthcare capability is there in case there is another peak, and then you also want to ensure that those workforce safety protocols are in place also. So those are things that we're actually openly not only discussing with our economic development partners across the state of Michigan, but have also brought in some of our trade associations. We had a call yesterday with Automation Alley talking about what's the new workplace going to look like, how can we work out with our HR professionals, how even we as a county begin to scale in workers. These conversations are starting, but on a very minimal scale, but we're going to start ramping up and using that data as the baseline.
It's interesting when you talk about that fact-based nature, you know, of you know, what are the facts? And I think most people will recognize, you know, if you tell me what the facts are, you tell me what the concerns are, you know what, I'm going to try to figure out, you know, how do I be part of the solution? And you're going to find that people are going to want to do that. So this whole best practices in the workplace, you know, I got to believe if most people are told, hey, listen, right now you don't want to put yourself at risk, your employees at risk, or the public at risk, you need to wear a mask. Most of them are going to want to comply with that, and they're going to kind of follow it. But when you start telling people what to do. I think that's what creates that bit of tension, if you will. A lot of people don't like to be told what to do, but many people want to be part of the solution and want to be helpful. And so I think that's what's going to end up happening here is you're going to start to see as they start to migrate towards allowing some of these businesses to reopen, they're going to once again kind of overlay that with, best practices, making sure they're mindful of that. And if that happens, I think we're going to start to see the progression of opening certain, I guess if you will, types of businesses in and around the county and around the state, but making sure that people are adhering to that. And I think a lot of the businesses I've been hearing from them saying, listen, we're willing to do that. We're willing to make sure that we're going to be safe in how we operate. Give us a chance to get back to work. So, but again, it's all based on facts, statistics, data, and making sure that that curve is starting to go in the direction that we're hopeful. And the healthcare professionals are telling us, okay, we're getting there. You can start to go ahead and open it up now.
Being part of the solution is going to be the best part because we've reached out to a number of companies that are willing to do whatever is needed from a workforce and safety perspective, also from a supply chain perspective for that critical infrastructure needs that we have here today. And I think we're getting really close to a community-based solution there, Mark.
Yeah, so again, mentioning fact-based, continue to update yourself by going to macombgov.org. Tune into our daily programming that we are trying to update you on, as well as look at some of the options we have available for the facts and information dealing with this COVID crisis. So once again, thanks for joining us. Stay safe and keep you and your family safe as well.